Good morning, everybody. Thank you so much for joining us today. We've got a really packed agenda, so we're going to get started right at 10:30. I'm Gina Capadou. I get to be one of the program coordinators with Kids Mental Health Pierce County, so I just wanted to welcome everybody. So, like I said, we're going to get started right at 10:30 because we do have such a busy agenda. So I'm going to go ahead and kick us off. Thank you all so much for being here today. We're Kids Mental Health Washington, and we are very excited to give an overview of this program model expansion that's taken place over the last 2 years, I should say, give some updates on some of the data that's been collected, how it's being utilized, and then also give the opportunity to have everybody get to at least see some of our team because it's gotten so big. And we're going to give you some information on how to connect to your local teams also for our Kids Mental Health Washington partners. So just a couple of housekeeping pieces. We're going to have everybody muted today and off camera, mostly for my bandwidth more than anything else when it comes to internet capacity. But please do utilize the chat. Please utilize the Q&A, and I will be monitoring that throughout. If we don't get time to have all of your questions answered, I will be collecting all of those. And if you just include your best contact information, we will make sure to follow up with everybody. And we're going to be sharing out these slides after our presentation, so you'll have access to those. And since this meeting's being recorded, you're also going to be able to go back and watch those pieces as well. So with that, we're just going to jump right on in. Some of those learning objectives that we wanted to prioritize for today is getting you connected to your local teams. Kids Mental Health Washington, as the name implies, is a statewide program, but we want to make sure that you know what's going on in your local communities with your local partners. We also, like I said, are going to give an overview of some of the data that we've been collecting throughout this program for the last year. And then we're going to give some local examples of some wins and some lessons learned from the teams that are doing the work. And then we just want to give an overview of what this model is. So that's where we're at today. We're going to jump right on in, but I'm also curious about who's in the room with us. So we're super excited. We've got almost 200 people that have registered for this webinar. I see them pouring on in. So if you all can drop in the chat what county or state you're coming from, because we do have partners that have attended in the past out of state, even out of country, which was pretty cool. We'd be really curious about what system or space you're representing and what some of the biggest barriers you're seeing there are in accessing care and addressing care for youth behavioral health. So go ahead, drop those in the chats, and we're excited that you're here. So what I want to do is get us kicked off here with a video just to kind of get us oriented of what we really think this is all about and why collaboration and partnership is so important. Alrighty, well, we're going to kick off our Friday, I guess, with some tech issues. Thank you for those of you that let me know in the chat that the chat was actually not working, or I should say the video is not working, or the audio on the video isn't working, excuse me, and the chat function. So thank you for letting me know in the chat. We'll absolutely send out the video link. You can see it. But one of the key pieces for this video that's really core that we wanted to just kind of highlight is there is a tribe that really leads with every greeting, every introduction that is saying, how are the children? And so when we are focusing on Kids Mental Health Washington across the state, what we're really looking at is if we can all say the children are well, and that's all of the children, we're going to have thriving communities. And so that's one of the things that we really wanted just to set the tone for, that this video that we'll send out, that you'll be able to just kind of get oriented to. But we also wanted to talk about what the state of youth behavioral health looks like and a little bit about how we got here. So really briefly, I know that those of you that are attending this webinar today are going to be highly aware that our kids have a lot of behavioral health needs and our communities are looking for resources. We've got a lot of champions that want to support and partner in this work. So just to give a brief overview, Mary Bridge Children's Hospital is the backbone organization for Kids Mental Health Pierce County, which is the program that I get to work with and be a program coordinator for. But even before COVID was happening and we really saw this exponential increase in youth behavioral health needs and as well as acuity, we were seeing a 400% increase in youth coming to the emergency department for behavioral health needs. So this was prior COVID, and ever since then, it's just continued to be a steady trend. And I think what really captured this is a couple of things. Is back in 2021, Governor Jay Inslee had signed an emergency proclamation recognizing the current behavioral health emergency among our kids here in Washington state. Another thing that we also recognized was behavioral health crises. They come in a lot of different forms, and you're not going to be able to fit a family into a neat categorical box. There's often a lot of systems that these families are involved in. There's a lot of complexities in accessing care, and every family is going to have unique needs and unique presentations. So for that, what we like to reference is that there is no single system or partner that can have full responsibility or should have the full responsibility for meeting the needs of our kids, our families, and our communities. So with that, it's going to take a really strategic look at having partnerships across the state and really looking at the multi-factor complexities that tie into youth behavioral health needs. So that was kind of the foundation that we wanted to give. Is we had this emergency department influx of youth behavioral health needs. We were seeing that the governor had signed this proclamation saying, yes, this is an issue across the state for all of our kids, all of our families. So Kids Mental Health Pierce County came from that when we had our very first Children's Youth Behavioral Health Mental Health Summit. And what we decided as a community was that we needed to have all of our partners at the table to be able to address those multi-factor needs that tie into youth and family and community behavioral health well-being. So we needed to have representatives from all of our systems: juvenile justice, child welfare, community behavioral health, our schools, our community-based behavioral health, and nonprofit partners. It was really going to take all of us coming together to say, what are our priorities? Because these are our kids. So what can we do with all the limitations on resources, wait lists, workforce, all of those things that currently exist, to be able to say, what can we do with what we have, and how do we rally together to focus on what we can't do? So that was a little bit of what started the launch of the Kids Mental Health Pierce County model. I recognize I'm saying Kids Mental Health Pierce County when this is Kids Mental Health Washington, because this is the model that actually got to expand statewide that we're going to be speaking about today. So that's a little bit about the foundation of who we are. But what we recognized back then and what we hold true as Kids Mental Health Washington now is there's a lot of influencing factors. So we're going to have to be able to operate and partner along all these different aspects of the spectrum to be able to support kids, because they just don't exist in silos, right? So that's one of the key pieces of this model. And like I said, it's going to take partners. So for those of you that are joining today, we have over 100 people on this webinar already. We're grateful that you're here, and we're really going to call on you to be able to partner alongside you for the great work that you're doing so that we can do more as a community and a collective. And it's going to take all of us, including those that I named, right? Our youth serving providers, our school districts, our community mental health, our crisis service providers, our managed care organizations, our first responders. So we're really grateful that you're here, because we know that you're passionate about youth behavioral health in the same way that we are. So what are we going to do, right? What is this model? What is expanding across the state? So the Kids Mental Health Pierce County model, it's really important that we say that this model is expanding across the state. It's not being replicated, because the needs of our communities is going to be so different. The resources are going to look different across the state. So there are model components that are these pieces on the screen that are going to be the foundation, but how they're implemented and when they're implemented looks a little bit different. So one of the first things that is a key piece of this model is is each of the teams across the state, and there are 10, and we're going to show you how that's regionally broken up, they are providing directly behavioral health navigation. I heard a statistic that they can take on average 17 calls for a family to access behavioral health resources. So being able to know how to navigate, who to contact, and what are the resources is something that each of these teams are really great at gathering local expertise for, because they reside in the communities, they work in the communities, and they're able to have those partnerships to connect towards those resources directly. Another part of this model is the multidisciplinary team meetings, which we call MDTs, and we're going to go into the data of those meetings in just a little bit. But really what this is this is a very youth and family-centric meeting where the youth and or their caregivers show up to a meeting with all of the community partners at the table from that previous slide. So when we're talking about those that have child welfare involvement, juvenile justice, maybe they've got some behavioral health needs, they're engaged with the hospital system for behavioral health, all of those partners are coming to one space. So I know if you can imagine for yourself, instead of making a phone call to 20 different organizations and showing up to 20 different meetings, what if everybody came to the family, to the youth, and said, we all are serving this family and all of us are showing up today because we care about youth and their families in our community. So all of us are getting the same information, and let's make some real-time resource referrals so families can get connected right away. And then these Kids Mental Health Washington teams, they're facilitating those spaces where you've got all those providers and partners on a call with the family and or the youth, and they're making sure that they do that follow-up connection so these families aren't falling through the gaps. The last piece that I want to call attention to is they're also organizing local steering and action committees, where these are community level partnerships with leaders in local communities that are able to make decisions about what are we all going to do with and for families. So maybe that's going to be everybody's going to agree that we're going to update a live provider document so we know what resources are taking referrals right now, what kind of insurance there is, and maybe like how to get connected. Or perhaps one of the things that our rural communities are focused on is they just need a central physical location to be able to access telehealth services. So how do we do that? Who's got some office space? How do we make sure there's internet capacity? And so really what it is the needs for how to access behavioral health for kids and families is going to look different in every community. And these steering committees are partnerships where everybody's speaking the same language and moving forward in collaboration. So those are some of the model components of what Kids Mental Health Pierce County started with to address kids' behavioral health across the state. But what we're really excited about is that's what became Kids Mental Health Washington. So in partnership with the Healthcare Authority and Developmental Disabilities Administration, this model is being rolled out across 10 teams across Washington state over 3 years. And Kids Mental Health Pierce County provides technical assistance in being able to say, here's some templates, here's some lessons learned, here's some ideas to get you started. But again, because it looks so different for every community, because every community's needs are going to be different, they're able to take those pieces and really make them their own. And we're able to learn from each other across these 10 teams, Developmental Disabilities Administration, and the Healthcare Authority to say, what does this look like across the state? So all of us are speaking the same language, and we're being able to elevate just what we're seeing on the ground in a streamlined approach. So those are some of the pieces we wanted to call attention to of this model going statewide. What I would love to do is turn it over to our buddy Megan, who's actually with Developmental Disabilities Administration, and talk a little bit about what DDA's partnership in this model has looked like. So Megan, I will turn it on over to you.
Thank you so much, Gina. I appreciate it. I'm Megan Hopkins. I use she, her pronouns. I'm with the Developmental Disabilities Administration. At DDA, we have 3 regional staff dedicated to Kids Mental Health Washington, and my role in the central office as the Kids Mental Health Washington program lead. Whether it's through DDA case management, Kids Mental Health Washington behavioral health navigation, or participation in MDTs, DDA staff are partnering to support youth with intellectual and developmental disabilities and their families in navigating service systems. These efforts are improving cross-system communication for more efficient collaboration, which ultimately supports our families in getting their needs met. Additionally, we're addressing barriers to accessing behavioral health services through developing relationships and sharing resources such as the ones you see listed here. For more information on DDA services, the Informing Families website has a wealth of information in text and video formats. The DDA Eligibility and Services Guide provides a comprehensive overview. For folks who want to learn more about dual diagnosis of mental health and intellectual or developmental disability, the DDA there are some wonderful resources linked here. DDA's guidebook, for example, describes common diagnoses and treatment modalities and the ways that they may be adapted. We value this partnership with all of our Kids Mental Health Washington teams and the Healthcare Authority, and we're so excited to continue collaborating as the program evolves across the regions. Thanks, Gina.
Absolutely. I was in the background also trying to see if I could get that chat function turned on. So I think people should be able to have access to that now. So now, if you want to give us an update on who you are, so if you want to say what county you're coming from, what system you're representing for those of you in the audience, and what some of those barriers to care are, we'll be able to capture those and follow up. You're also welcome to continue using the Q&A aspect of this as well. Kudos to Alyssa for being the first comment already. So I know that that chat function is working. So thank you so much, Megan, for bringing that overview of DDA's partnership in this model. One of the things that was really key about this model, including Developmental Disabilities Administration, right from the get-go is expanded statewide, is so many of the kids that we were seeing in the emergency department, again, going back to that history of Mary Bridge Children's Hospital seeing this increase of youth coming to the emergency department for behavioral health, is so many of them had intellectual and or developmental delays that were either diagnosed or not diagnosed. And also, we're continuing to see a huge call from our partners across the state about neurodiversity training. How do we access certification? What do resources look like? How do I navigate DDA? So having DDA from the get-go as a partner right alongside us as this model has stood up over the last 2 years has been absolutely critical. So Megan, thanks for your leadership on that and for your partnership there. So a couple of pieces that I wanted to say is we've talked about the model, right? We've talked about what the model is. We've talked about who the partners are. How did we go across the state? So what we really wanted to speak to was this model expansion happened with some legislative funds where we were able to get the dollars to stand up the teams across the state. And these are the teams. So I know we've got people coming in from all over the state, from different systems. I'm seeing in the chat already that we've got our teams from Kids Mental Health Washington that are here. I'm seeing some policy program managers. I'm also seeing school partners are here. So I know all of you are coming from across the state and across systems in different positions, but these are our team breakdowns. So we've got 10 teams that rolled out in a tiered model. So I'm going to ask those of us that are from Kids Mental Health Washington, if you can just kind of come on camera, if you got capacity, and wave, just so as I call out your regions, people can see who you are. They're also going to be dropping their contact information in the chat. And then also we're going to make sure that we drop the Kids Mental Health Washington website in the chat so that you can get connected towards these partners that are on the call today. So of course we started with Kids Mental Health Pierce County, but the first 3 teams that actually stood up back in 2022, so it's been 2 years already, are our friends in the Salish community, these 3 counties here. We had our friends in Southwest, which are these 3 here, and then we also had our partners over in Greater Columbia, and this was a 9-county region that stood up. So we're super grateful that they're here. If you live in those counties or serving families in those counties, or you're just curious about what they're up to and how to get connected, they're going to be dropping their contact information in the chat so you can get connected there. So thank you to our original regions that were brave enough to be the first 3 to select into standing in this model up. And then back in 2023, so just last year, we were supposed to have 3 more regions that rolled this model out across the state. But thanks to some willingness, effort, and some ARPA dollars, we were able to have 4. So with that, we actually had our friends at Thurston Mason. They were the brave group that said, yep, we were going to start in 2024, but put us in. They launched in 2023, and that's going to be our Thurston Mason region. We've also got our Great Rivers partners, which is going to be these counties right here in the green. We've got our friends in North Central that are Okanagan down to Grant County here. And then we've also got our partners in Spokane that are Ferry, and Berry County down to Adams County, all the way over here to the state border. So we're happy to have them. You're going to see them waving on the camera for those of them that have capacity. They're also going to be dropping their contact information in the chat, like I said. And then last but not least, starting this year, we actually had our last two regions, making it a truly statewide program launch, which is going to be our partners in King. I see Carson's coming online as a representative from King County, and then our friends in North Sound that were these counties right here. And I see that Angela's waving as well. So this model has been a tiered rollout, but it is, as of 2024, a statewide program. I will say hold your horses for our friends in King and North County counties because they just launched in July, and you're going to hear a little bit from each of the regions that were for a region for each of these rollout models so that you can see who they are, what they're up to, and just some of the successes that they've had. So with that, I'd love to give an opportunity to create some space for our regional partners so that you can hear about some wins that they've had and what it's been like being able to stand up this model and really make it their own for their community needs. And so I'm going to kick it over first and foremost to our Greater Columbia partners that have those 9 counties with our friend Meredith that'll talk a little bit about what that's been like there. So Meredith, I turn it over to you.
Hi, good morning, everyone. Can you all hear me?
Sure
Awesome.
can.
Okay, perfect. Well, yes, we are very excited to be a part of Kids Mental Health Washington. As mentioned, we do have quite a large region, 9 counties. Our last county, Yakima County, will be launching January 1st, 2025. So we're very excited to be almost fully launched. With that, the Youth Navigator program has really provided us, I think, a really unique set of challenges. As we have such a large region, we have had to, I believe we will have 6 different MDT teams that we are running. And although that can be a little bit difficult to try to organize, I think what is really unique about this program and our region in general is just the ability to have providers and members of the team that are really unique to each county and area that the families live in. So one big advantage that we have found is, as we have kind of left Benton and Franklin County and started expanding out, just discovering all the different resources that are available in the community. And I think when you involve people that live and work where the families live and work, I think you get a lot of really great information. You kind of get that insider information about what services are available. You know, we have a range of people that are on our MDT teams that range from newly out of school, maybe 2 or 3 years, to people that have 20 and 30 years of behavioral health experience. And so they know a lot about the community, they've lived in the community, they've worked there. And I just think that that can provide us with some really great information. It provides us with a lot of good connections for families. And I think, you know, you look at some of the providers and some of the members that are younger, and maybe not as experienced, they have this really great ability to have a unique perspective and be able to kind of think outside the box and provide some families with information that we might not have thought of, or interventions we might not have thought of. You know, we had an MDT where was in a little bit more of a rural community, and the mom said, as the meeting was completed, she said, "Oh my gosh, I'm so glad that we had this meeting. I didn't know that there were so many resources available in this tiny town." And so I think that really does highlight what part of what the Youth Navigator program is really set out to do, especially in regions that have a lot of rural areas. There's lots of people in our communities that have shelters or have food banks, or they have different resources that we don't all know about. And this gives us an opportunity to really shine a light on some of those lesser known resources and really try and get families connected to things within their community that are sustainable. You know, we know the research has shown that youth remaining in their community with their family is really one of the better interventions that we can have. And that really provide the youth with the most support versus sending them somewhere else or going to treatment somewhere else. And so those all have their places, and I'm a believer in that. I think what our program is able to do is kind of help connect family even more within their own community, and provide them with the support that I think will be beneficial for them that can kind of carry on. And so along with that, so we're really excited just to be able to do that. And like I said, as we've been moving to other parts of our greater Columbia region, we really get a chance to see that. And that's been really great for us as a team. The other thing that I just want to mention too is making sure that we have resources that families can find. Even if a family doesn't necessarily need an MDT or want one, we want everyone in the community, including providers and teachers and school counselors and first responders, to be able to have a website and a place where they can direct families. That's an easy place to go, so that they can search resources, get education, find community events. And so another part of our program, along with the help of our amazing web design aficionado person, fantastic, amazing guy, Mark, he's really helped us to design a website and provide resources, an ability to provide resources in an easy way. And part of what we do within our YARP program is really make sure that the websites and the resources are up to date. So we do have resources that are listed out by county, and some have statewide resources available, as well as local resources. And we have partnered with ESD 123, who initially was working on resources for Benton and Franklin County. And so we partnered with them to kind of work to expand that. And so another part of our program is really making sure that our Find a Provider tab is up to date. And what that means is that we list providers that are in our community, such as comprehensive health care, what ages they see, if they have any specific type of therapy, like trauma-focused therapy or different things like that, what insurances they take, their wait list, if they have one and how far it's out, and then if they have bilingual staff. And so we really want people to be able to access that easily and not spend a lot of time calling places and trying to get in touch with providers that don't have openings or don't accept your insurance or don't don't work with 13-year-olds. So we want to make sure that we're keeping that up to date. Our team works really, really hard to do that, along with ESD 123 staff. And we're really proud of that. And we really hope that we can continue to provide that service to our families and the people within our community. So thank you guys all. Thank everyone that's here that has collaborated with us as part of the YARP team in Greater Columbia. We really do truly appreciate you. I know I went over my 2 minutes, but I'm just really thankful that we have such great community partners that are, basically taking up their time to meet with families and collaborate with us. So thank you so much. And yeah, thanks.
Thanks, Meredith. I really appreciate it. So that was one of the first regions that got to launch. If you think back to that map slide that we had, so who I'd like to turn it over to next was actually one of our second waves of launch, which is going to be Brooke, who oversees both the North Central and the Southwest regions. So Brooke, without further ado, I'll turn it over to you to talk about what it's been like for your teams.
Hello. So I am mainly going to talk about our wonderful North Central region. We have 3 amazing team members in North Central: Chrisanna, Coral, and Christy. And I just can't help but smile when I say their names, because they are 3 really incredible individuals that have put their heart and soul into getting this program up and running in North Central. And I am from the Vancouver area, and so I'm most familiar with that area, but I have had just such an honor of helping this program get going, and getting to know the community members in North Central has just been wonderful. So all of you on this call from North Central, thank you so much for being so amazing. Every meeting I go to, it's nothing but warmth and collaboration. And it's a unique area. There's not a lot of resources, but what I see from this community is everybody coming together to put whatever they can out there for youth and families. And it's a really incredible thing to witness. So I just want to put that out there first and foremost, that you're an amazing community of individuals. And it really does show in our work with families. And so since we started taking referrals in March of this year, so we started late March, we've gotten about 90 total referrals. And of those referrals, we've had 14 youth and families who are tribal affiliated. And so I'm going to talk a little bit about what that process has looked like, because it's something we're really, really proud of. And we've been able to collaborate with tribal behavioral health. I took a trip up to Nisbelem recently in Okanagan County and got to meet with the tribal partners there, and that was really wonderful. It takes a bit of a unique skill set to work with a really rural community, and this team has done a nice job of that. The youth that we are referred for our youth navigator team they tend to be very complex and have a lot of needs. There is significant trauma, SUD, and not a lot of resources. And so what our team has done is we are able to meet with families in person. So they try really hard to go out and meet with families where they're at, and their voice and choice in services is also of utmost importance. We recently had a referral for a youth that was in an inpatient setting that was going to be released back to his community, and was a tribal youth. And we were able to really pull together some intense meetings for this youth that allowed us to make a really solid plan of discharge. And that would not have happened unless we had our community partners at the table. And so in those meetings, we had the Colville Tribe, we had HCA there, WISE showed up, crisis services, we had social workers there, our team, CLIP. So it was really fantastic to see how that process worked. And despite just all of the challenges, there was a really solid plan for return to community. And Chrissy was able to do a nice job of working with the family who had little access to technology. And that's really, really difficult for a lot of our families in these isolated areas. And then we are also working really closely with our tribal HCA liaisons, and Raina Pion is wonderful. What we have done is helped our team become really knowledgeable in tribal behavioral health and fee-for-service Medicaid, so that we can really break down those barriers when youth and families are referred to us, and we don't have to jump through a bunch of hoops to get them the services that they need. So huge shout out to that team in North Central, and also just all the new teams coming on and all the collaboration that's happened in getting North Central up and running.
Awesome. Thanks, Brooke. And this is why it was so important to us when we were trying to figure out how much can we share in an hour about all the great work that's happening, is we wanted to be able to share how it looks different from each region in how they're providing services, who they're providing services to, but also there's going to be some lessons learned with each wave of this program standing up year after year. So for our most current wave, those that are standing up just as of July of 2024, we're very happy to have Angela be able to speak to what it's kind of been like looking for that experience regions of getting this program stood up, being able to leverage some of those learned experiences from the other regions that have already rolled out this model, and still be able to take this model and make it their own for their region in North Sound. So I'll turn it over to you, Angela.
Thanks, Gina. That's so funny. I was sitting here thinking about all the things I wanted to say. You guys can hear me, right? Head nod, Brooke, because I can see you. Yeah, thank you. Okay. And I was very struck in the beginning, Gina, when you were like, and we got some funding to do XYZ ABC. And I thought, oh my gosh, yes, we got funding. So I've been with North Sound for about 18 and a half years. And I can tell you that, like all the other regions, we have had iterations of care coordination and collaboration programs throughout those 18 and a half years that I've been part of, watching come online, come and go. And one of the most unpopular things about them was that most of them were unfunded mandates. And so for this new work, because it's kind of new old work, it's got a new iteration, and I'm liking that a lot. And it is coming with funding, which is great. I know that North Sound has been a bit of a mystery. I have had emails and different phone calls and things saying, hey, I'm hearing about YNP all over the state. What's going to happen in our 5 counties? So we cover Snohomish, Skagit, Whatcom Island, and San Juan. And like every other region, these are, they have unique geographical challenges. The population in our region is the second largest next to King. And so starting up these programs is necessary and a heavy lift. So we're really excited to get on board and do this. I think what I'm going to do is just kind of give an overview of where we are currently to help anybody that might be from our region on the call. So we have hired one individual as a care coordinator. We are seeking to hire a second individual, and these 2 folks will be helping me to design, stand up our steering committee, stand up our MDT teams, which we intend to put in each county, at least one. And there could be in the future more teams in our larger counties. But to start, this is the roadmap we would like to do. I had been on the Learning Collaborative listening to my ASO partners for, gosh, I don't know, Gina, over a year and a half, something like that.
Yep.
And have learned so much from them and appreciate them for sharing their resources and their time to help us do this. Because while we have had programs similar to this in the region, this is different, and I'm thinking it will be pretty good. There was something else I was going to say and I forgot what it was. So I think currently, however, since we do not have those teams stood up, you can contact me if you have a case that you're struggling with. I know that there have been contacts through Gina as well. And she kind of funnels those to me. And we are still doing our care coordination. We are still doing all the things we've always done in the past. But we're looking forward to being able to have these localized teams be able to address the youth needs. I think that's all I have.
Awesome. Thank you, Angela. And thank you to all 3 of our teams that presented about what it's been like rolling out this program over the last 2.5 years. So I think some of the key pieces that I really wanted to call attention to is they all have the same model components, right? They're providing the behavioral health navigation directly, whether that's in person, like Brooke talked about, or whether it's virtually, whether a referral is funneled through me because it comes through the Kids Mental Health Washington website, or whether it goes directly to the teams whose contact information you now have in the chat, now that I got the chat function working. I think it speaks to the Learning Collaborative that Angela referenced, where once a month, all of us from Kids Mental Health Washington, Healthcare Authority, and Developmental Disabilities Administration, we get together and we bring in a guest speaker that talks about something that pertains to the work, whether what it's like to be able to engage with hospital partners, because the goal is to prevent kids from getting to emergency department hospitalization for behavioral and health needs, to expedite their leaving the hospital system, or to prevent them from coming back to the hospital system because they have their needs met through their community as close to home as possible, like Meredith was speaking, right? There's also the local hubs of websites that people are monitoring for the Kids Mental Health Washington teams. They have created websites that are specific to their region for the entire continuum of what behavioral health services looks like. That can be after school programs, it can be crisis support. So we're going to dive into those in a little bit. So they're having the website and they're convening these multidisciplinary team members where you're getting everybody around a table with the kid and or the family. That's really the key part, because you can't be talking about kids, families, and communities behavioral health without them. So by keeping them centric at those conversations, you really are making the most impact, because you're being able to leverage the wants, the needs, and hear directly from those most impacted, right? And then you're also building those partnerships across systems so that you're being able to expand referrals to whatever resources you do have. And you're getting really creative for the just meeting the gaps of what you don't. Is we can't make the workforce appear overnight. We can't address the funding issues. But what we can do is we can build relationships and knowledge about what resources do we have, and have a coordinated effort of, as resources become available, how do we start to capitalize on those to make sure that we're working together so that we're breaking down those silos across our programs. But also knowing that not every recommendation is going to be a clinical recommendation for a therapy services. We've got to be really creative of what behavioral health resources means. Maybe it's going to be an equine therapy. Maybe it's an art therapy program. Maybe it's an after school service like the Boys and Girls Club. You really have to look at, just like those other resources that Meredith tapped into about, well, what about a food bank? So we've got nutritious food to be able to relieve some of that economic insecurity. So being able to say, what are the resources that all of us can pull together so that all of us are coordinating supports with these families? So one of the things that I really wanted to dive into next, now that we've talked a little bit about what the rollouts looked like, being able to connect to your teams, and being able to hear some of those successes across the state, I wanted to talk about the data we've been collecting. So I've referenced that this is a partnership for Kids Mental Health Washington between the 10 Kids Mental Health Washington teams, which you've been introduced to, the Healthcare Authority, and Developmental Disabilities Administration. We really want to give a huge shout out to our Healthcare Authority partners. They're the ones that hold the contracts, but they're really also really key partners in helping us tell the story of what does kids behavioral health look like across the state. And so these 10 teams, Kids Mental Health Washington teams, were able to create their own reporting metrics to be able to capture what does behavioral health look like for kids and families across the states, and being able to say what that coordination has looked like of how services are being provided. So with that, we're going to dive a little bit into what that's looked like. And I wanted to highlight that these are qualitative and quantitative measures that are being kept. These were created by and with the regions. So they came up with the metrics, they've established the cadence, and that's a really, I think, rare opportunity. Rather than having funding that comes available and a report that goes with it, these regions had a really cool opportunity to be able to say, this is how we think that we can track it. And through that learning collaborative and the historical ties of the backbone organizations that are implementing this work across the state, they're able to say, this is how we want to be able to tell the story of what it is that we're doing. So one of the things that we really wanted to make sure that we were tracking, which is, of course, the age of the kids that are being served, how soon they were getting connected, what kind of systems are they involved in, so we can identify those pieces, and then which partners are being engaged and what kind of services are they being provided. And I also want to highlight that this program serves kindergarten through 12th grade youth, and it's at all levels of behavioral health acuity across the state, and it's regardless of insurance. So whether they have Medicaid, commercial insurance, dual insurance, no insurance, this program will be able to serve all families, and they'll provide that behavioral health navigation to navigate whatever that insurance structure looks like and whatever the level of acuity is. So we wanted to call those pieces out, and we're going to give some examples of what that behavioral health navigation has looked like. So here is the data. So we talked about those multidisciplinary team meetings, those MDTs that these teams are convening across the state. That's where you're bringing the kid and the family to a space, whether it's in person or virtual, and you are bringing a coordinated, intentional group of people to the kid and or the family to be able to meet whatever the scope is that the family is requesting. Sometimes it's outpatient service navigation. Sometimes it is a hospital discharge. Maybe it's behavior management management strategies. So whatever the ask is that the family has, they bring those key partners together that they have relationships with to meet with the kid and the family, make some targeted recommendations, make some introductions so these kids and families have a face to a name. And then the Kids Mental Health Washington teams will follow up to make sure that those connections and referrals happen. So from July of 2023, which is when we started collecting this data, to the end of June of 2024, we had 352 MDT referrals come in. And of those 352, we had 131 meetings hosted across the state. That is 131 convenings of diverse community stakeholders meeting directly with the kids and or the families. These meetings do not happen without the kids and or the families, so that is a very family-centric space. And what I wanted to call out as a win is while we had 352 referrals, but only 131 were held, I'll say 131 meetings with kids and families across the state is absolutely a win. But what we want to call out is that not holding a multidisciplinary team meeting is also a win, because we know that when partners are coming to these multidisciplinary team meetings and volunteering their time, their resources, and their expertise, they're really busy. So if these behavioral health navigator partners across the state are able to get families directly connected towards a resource or an agency, that is a steward of the community resource because they're not convening those. It's also a really trauma-informed approach because particularly like in our smaller rural communities, when you bring all the partners to the table, a lot of times there's pre-existing history or relationship, and it can just be really scary, right? It can be re-traumatizing showing up to a meeting for a group full of people and asking for help. So we wanted to call out that while we've had this amazing number of referrals, we want to make sure people put these in, and we'll continue to host these MDTs across the state. Not having an MDT is also a win. And so what we also wanted to call some attention to is for each one of these MDTs that are held, we have on average 13 different partners that are representing. So that is all of the partners speaking the same language with the kid and or the family, making live real-time introductions for resources and agencies, which is a huge win, but also that adds some professional development opportunities for everybody that's attending. Meredith had spoken before about like a family saying, I had no idea all these resources existed in my small community. We actually pulled locally, and I'll only speak for Kids Mental Health Pierce County, that for every MDT we had, 99% of the time, the provider and or the family walked away from an MDT saying, I learned of a new resource or I learned of a new opportunity that a resource in my community can offer. So that is expanding our knowledge of getting families and community partners connected. And we're not always going to be able to find an answer because there's going to be resource constraints. But what we can do is encourage families to say, we are a community that cares about you. And look at all of these people that have showed up. Again, on average, you've got about 13 people. But also, it really helps address some of that burnout that partners can feel when they don't know what the resources are by being able to say, you've got company in this work and you've got partners that are able to come together with you. So that's the average number of attendees that we have that come to these meetings. But what's been really great is they've been as small as 4, but they've also been as big as 33. It really just depends on what the ask is from the family and or the kid, and being able to look at those community dynamics of what are the resources and how do we match those two up. What we're also saying is, again, this program serves kindergarten through 12th grade, regardless of insurance, that on average, the kids that are being referred for an MDT are about the age of 12. What we're seeing across the state is particularly for our kids 13 and under, it's hard to, 1, find a provider to be able to serve that population, but 2, you also have to look at for 13 and up, being able to navigate that they're able to seek their own services without caregiver consent, and they're able to be their own advocates. So we've noticed that has definitely been a way to pull the community together to address that. But for all overall referrals, we're saying that kids are being referred as young as the age of 1 all the way up to the age of 20. And what we do know is while our sweet spot is kindergarten through 12th grade, because we know that there's a really robust 0 to 5 services, and then there's an entirely different system when you go 18 and up, we're not going to turn away partners. If there's a family that has needs and we can connect towards resources, we want to make sure that we're doing that. But what we are seeing is we've ended up hosting these MDTs across the state from the ages of 4 to 19 years old for the kids that are being supported with this service. But what we do know is that the average age for the MDTs that are being held, again, is right at about that 13 years old age range. When it comes to an insurance breakdown, like I said, this program will serve any kid, any level of acuity, regardless of insurance status. What we're seeing is for those that are being referred, you got about 62% of them are on Medicaid, 22% have commercial insurance, about 1% are dual insured, TRICARE, tribal, and then the rest are 13%. And when we say what's the other, that's that 13%, that can be uninsured, it could be the information is unknown, but what's really important for this team is that even if they don't have the insurance information, if they're able to provide that high level behavioral health navigation and get them connected, because usually it's a non-clinical support, that's something that they're going to be able to move forward in doing, because again, it's not dependent on insurance. So that is our overall referrals. That's that 352 number that you see at the top. What we did want to dive into is what about the kids and the families that are being served that do rise to that multidisciplinary team level, where we really do need some collaborative approaches, partners around the table with the kid and the family to be able to meet what those needs are. And the percentages stay about the same. You've still got about 60% of them are going to be Medicaid youth. You've got about 25% that are commercially insured. You've got about 2% that are going to be dual insured, 1% are tribal, and again, that other is about 13% for the same reasons. So again, why are people referring to this program? So some of the top reasons that people are referring is outpatient service navigation, where these teams do the behavioral health navigation. They're looking for care coordination. Is there's so many services going on that we just need to all be on the same page, speak in the same language. But also what I've heard sitting in on MDTs across the state is families will say, I'm so sorry, I can't remember if you were with this agency or this agency. And maybe I got a call from this person, or maybe you were involved with this person. Because our families are in crisis, oftentimes by the time they get referred to this program, or they've got so many services, these teams are being able to pull all the partners together with the kid or the family, have the same information be heard in real time, and then be able to take meeting minutes that are shared with the family to say, this agency is committing to doing this thing. This partner is committed to doing this thing, and this is a resource that you can get from this person. Here's all their contact information, and I'll make those warm phone calls with you. I'll do those warm handoffs so that we can get an email introduction. Sometimes it's going to be even as deep as I'll do that application for insurance with you, just so you can expand your provider network so that you've got more resources to tap into to meeting whatever that need is. So when we're looking at those 352 referrals across the state, outpatient service navigation, care coordination, and behavior management strategies are the top reasons. But when we're looking at who actually comes to these MDTs, it gets mirrored for that exact same purpose. And then we also did a deep dive into who's actually sending these teams at Kids Mental Health Washington the referrals. Our biggest partner is going to be our schools. Something that's really inspiring to me personally is that parents are also self-referring, that they're putting trust in these local teams to be able to support them and their youth. And then we've also got our system partners. So that can be juvenile justice, that could be child welfare. So looking at that system lens, so being able to say that our local community hubs of schools are being able to partner with these teams, knowing that families have trust in these teams, and knowing that the systems are looking to have some care coordination and support so that there's that inner dynamic that's happening, that's really inspiring for me. So that's some of our data. I knew I threw a lot at you. Again, we're going to be able to disseminate these slides after this presentation so you can dive a little bit more into that. But those are the high-level MDT numbers that we've been tracking for a year's worth of data. What I also wanted to call attention to is that these teams are doing direct behavioral health navigation, where they're able to get those resources and connections happen with the communities, partners, and the families without having to bring everybody together to be good stewards of those resources, and also because they're experts of some of the local opportunities that exist in their communities. So when we talk about what behavioral health navigation, these are just a couple of the examples that we wanted to call attention to. Sometimes that could mean doing a telehealth therapy referral. Maybe it's going to be connecting to peer partners and family voice that you can get some local advocacy. Maybe it's getting connected towards some after school programs. It could be getting connected to extracurriculars. It could be getting connected to LGBTQIA support groups. We've also seen behavioral health navigation get referrals to crisis teams, hotlines, and these are all recommendations that can be clinical or could be non-clinical, but what we do always want to make sure is that we're looking at families holistically. So that's what it's looked like, and here's what some of the impact has been, is we've taken that data of who are we serving, in what capacity, with what services. And we've been able to take that data, and we're going to be able to utilize this to make some escalations towards some of our system and our policymakers in our communities by bringing this to our local steering committees to say, we've been able to create this data, that this is what we're seeing. Can you share with us what data you have and what you're seeing, so we can see what kind of similarities there are and what kind of differences and why, and be able to use that data to have data-informed decisions to drive those local community initiatives. And some of those initiatives that we've seen has been doing evidence-based program expansion for mental health programs in schools. We've also been able to see some really great collaboration of making recommendations of, by pulling all of our data, including the data that we've made at Kids Mental Health Washington, how do we want to spend 1/10 of 1% behavioral health sales tax dollars that are popping up in counties around the state. But also we've been able to do some really great opportunities of having consistent messaging about awareness of resources and referrals, so that we've just got stronger integration for what we do have to maximize the resources that exist currently. So that's some of the community impact that we've seen. But I think what really drives it home is, what are the kids and the families saying, right? So some of those pieces that we've heard from families, again, these meetings do not happen without our kids and families present for our MDTs. So they're having 100% caregiver attendance rates. So they are the voices that are driving their care, and the community stepping in alongside them. And what our families are saying is, parents are saying that, I believe that this is a great approach. We've got some partners that are saying, thank you for being here for my daughter and I when I needed you, and just how much it's been able to help having these resources available. We've also heard families be able to say that supporting the transition of kids discharging from the hospital with these teams has been really critical, but also just that families are feeling good and they appreciate just the wide range of ideas of knowing there are practical, easy things that you can do that aren't clinical recommendations, all the way up to the clinical recommendations, and just being able to help families breathe a little easier when there's things going on that they can't control. So as these programs are standing up across the state, as we're collecting this data, and we're going to be able to utilize it to inform care locally for the Kids Mental Health Washington teams, but also be able to have it be implemented and utilized by their local community steering action teams, is we're going to be able to continue to use our teams and use the data to make some really big opportunities happen across the state, whether that's going to be continuing to support how behavioral health tax dollars are used, because these are community collaborative spaces, being able to look at how do we engage youth in steering committees so that they have paid opportunities to utilize their voices in some of our regions even, and then just continuing to look at, what does statewide expansion look like, so we can capture what behavioral health looks like across the state, but also being able to say we are truly a statewide program as our King County and our North Sound partners come online. So we've talked a lot about care coordination. We've talked about outpatient service navigation. You've got to meet some of those teams. Some of the frequently asked questions I wanted to be able to close with here is, people always ask of, are youth with or without lived experiences going to be part of this initiative? And they are. These meetings do not happen, like I said, the MDTs, without the kids or the family voice present. They're engaged with our steering committees, and then we are actually offering services, resource, tables and tabling at resources at local fairs to go where the kids and the families are, rather than make the families come to our services. So that's really a big piece. And I think that also speaks highly for that next frequently asked question of, like, what about parental involvement in the service provision? Again, these meetings don't happen without the kids and or the caregivers, but we also lean really heavily on our peer partners across the state. So making sure that they're part of our steering committees, our multidisciplinary teams, and doing tons of referrals of making sure families have access to those peer partners. We talked a little bit about some of the opportunities that are being navigated too, but what's really intentional is we know that there already are multidisciplinary convenings like our CLIP programs, our WISE programs, FISPR, and those. So being really intentional about engaging those partners from the beginning to say, what gaps do you have that we can come alongside and add capacity to, so that we're being really efficient with the resources that we have. And then last but not least, what's the criteria for having youth be referred to this program? Kindergarten through 12th grade is our sweet spot. It does not matter whether they have insurance or what type of insurance will be able to support them. And this is really any level of acuity. Primarily the focus that's going to be prioritized is the kids that are in emergency departments for behavioral health needs, those that are boarding, but we want to get to them as early as possible and support a discharge where they're not having to go back because they have the resources that they need. So if you're really curious about what resources exist in my community, how do I make a referral for an MDT? How do I get support from the behavioral health navigation these teams offer? Or what else can I do to partner alongside this effort? What you'll see on the Kids Mental Health Washington site is that there's going to be an interactive map that's going to look like the map that we brought up of the state with the different regions. You get to be able to click on that map of the county that the kid lives in or their caregiver or where you're providing those services, and it'll get you connected towards the local resources. And these are some of the things that you're going to see: crisis services, intellectual and developmental disability resources, There's going to be parent supports. There's going to be that find a provider tab, much like Greater Columbia talked about. What we do want to put an asterisk on is every community's resources are different. So it's going to look a little different for each. So we'll close out with just saying, if you've got any questions, please go ahead and reach out. These are going to be sent out to the attendees afterwards, but we just wanted to thank you for hearing a little bit about our program. I want to thank our regional partners, Healthcare Authority and Developmental Disabilities Administration, for being able to speak to this program today. And for those questions that are in the chat, I'm going to make sure that we follow up with those as well as a new frequently asked questions document that'll go out with our slides. So with that, thank you all so much. We're excited to partner with you, and thank you for all of the passion and support and championship you're doing with kids and families in your local communities. Thanks so much, everybody.